Imagine your head as a high-tech helmet, not just built for protection, but designed to support vital functions like seeing, hearing, and eating. This helmet, known as the human skull, is a marvel of nature's engineering. It's made up of 22 special bones, each fitting together like a complex 3D puzzle. Today, we're going to unlock the secrets of this incredible structure and discover how each bone plays a crucial role in keeping you safe and functioning every day. The human skull is a complex structure made up of 22 bones. These bones are divided into two main categories: the cranial bones, which encase and protect the brain, and the facial bones, which form the structure of the face. Here's a detailed overview. Cranial bones. The cranial bones are 8 in number, and they form the cranium, which houses and protects the brain. These bones are: the frontal bone is the single, large bone found along the anterosuperior aspect of the cranium. It is classified as a flat bone, forms the forehead, and contributes to the formation of the neurocranium. The frontal bone consists of right and left frontal sinuses and includes the following bony features. Did you know at birth, the right and left halves of the frontal bone remains unfused, with a metopic suture frontal suture located between them. The right and left halves of the frontal bone fuse within the first year after birth. Parts of frontal bone. The nasal part, also known as nasal process, is the small, inframedially located portion of the frontal bone. The nasal part consists of the nasal spine and nasal notch of frontal bone. Laterally, with the orbital parts. Superiorly, with the squamous part. Inframedially, with the superior borders of both the right and left nasal bones, forming the frontonasal suture. Infralaterally, with the frontal processes of both the right and left maxillae, forming the frontomaxillary sutures. Posteroinferiorly, with the superior aspect of the ethmoid bone, contributing to the formation of the frontoethmoidal suture. The orbital parts, also known as orbital plates, are the two infralaterally located, horizontal, curved portions of the frontal bone. On its corresponding side, each orbital part is continuous medially with the nasal part and continuous superiorly with the squamous part. Consists of orbital and cerebral surfaces and a sphenoidal margin. Contributes to the formation of the roof of an orbit and the anterior cranial fossa. Articulates posteriorly with the greater and lesser wings of sphenoid bone, forming a sphenofrontal suture. Articulates inframedially with the superior aspect of the ethmoid bone, contributing to the formation of the frontoethmoidal suture. The squamous part is the superiorly located, thin, curved portion of the frontal bone. It is continuous. Inframedially with the nasal part. Infralaterally with the orbital parts, the squamous part. Consists of internal and external surfaces and a parietal margin. Forms the forehead. Articulates with the frontal borders of both the right and left parietal bones, forming the coronal suture. The anterior ethmoidal foramen, also known as anterior ethmoidal canal, is a small anteriorly located opening found along the junction between the frontal and ethmoid bones. Each anterior ethmoidal foramen is located lateral to the cribriform foramina and anterior to a posterior ethmoidal foramen. The anterior ethmoidal foramen allows for the passage of an anterior ethmoidal artery, vein, and nerve. The foramen cecum is a small opening found along the anteromedial area of the anterior cranial fossa. The margin of the foramen cecum is formed anteriorly by the frontal crest of frontal bone, posteriorly by the allay of crista galli of the ethmoid bone. Did you know? During fetal development, the foramen cecum allows for the passage of a vein from the nasal cavity to the superior sagittal sinus, which may continue to be present in some adults. The opening of the frontal sinus, also known as frontal sinus ostia, is a small opening found along the anteroinferior aspect of the frontal bone. Posterolateral to the nasal spine of the frontal bone, the opening of the frontal sinus allows for the communication between a frontal sinus and a middle nasal meatus. The posterior ethmoidal foramen, also known as posterior ethmoidal canal, is a small, posteriorly located opening found along the junction between the frontal and ethmoid bones. Specifically, it is situated lateral to the cribriform foramina and posterior to the anterior ethmoidal foramen. The posterior ethmoidal foramen allows for the passage of a posterior ethmoidal artery, vein, and nerve. Understanding the frontal bone is crucial for studying the anatomy of the skull, neuroanatomy, and the overall structure and protection of the brain and sensory organs. Thanks for joining us on this exploration of the frontal bone. Don't forget to subscribe and stay tuned for more in-depth anatomy videos.